Next, you can use your phone to download store apps for their rewards programs to see if they offer additional savings. These savings may include coupons or different buy one get one free options so you can stock up on foods you use frequently and save money at the same time. You can also try ordering your groceries online and using the store pickup service to save time and potentially save money by avoiding last-minute impulse buys at the register, such as candy and sugary sweetened beverages. Next, to create a budget, you want to figure out how much money you have allotted for food. So let's say if you have $75 for breakfast, lunch, and dinner for all week for your entire family, you want to see what meals you want to eat and what items you need for those meals, because you don't want to go to the grocery store and plan to buy these food items for the meals you have planned, and now you've left and you have $75 plus in groceries, but you didn't purchase anything on your list. So it's important to allot for food and stick with that budget to save money. Creating a menu for the week or for the month, or even bi-weekly, whatever works for you, will help not going over budget if you shop with the list. And that way you know what meals you'll be eating for the week and what food items you need. What I like to do is keep a running grocery list on the fridge. And when I open the fridge and see amount of coffee creamer, I jot down on there that amount of coffee creamer. You can also keep an on-hand list as well on the fridge. That way you can see what food items you have and maybe can challenge yourself to make a meal with just these items that you have, or create a meal purchasing as few groceries as possible. So before you run to the store, always take a quick glance in your cupboards and pantries to see what foods you already have, so you're not spending money on extra food items that you don't need. And we all know grocery shopping can be a daunting task, so just keep it simple. Shop the perimeter, which is the outer walls of the store. If possible, this is where the freshest foods are found on the perimeter, such as produce, meat, and dairy. Only go down the center aisles to pick up foods on your list. This will help you avoid temptation of processed foods, which the center aisles are where they're typically located. However, don't get me wrong, not all foods located in the center aisles are bad for you. For example, canned tuna is a great source of protein, and it's found down one of the center aisles. So you can go down the center aisles, grab what you need, and head back to the perimeter for fresher options. And now that you've purchased your groceries, you want to get the most bang for your buck. So what you can do is prepare your own snacks versus buying prepackaged. This is a great option because you can customize it to your preferences. So if you like a certain flavor of hummus, maybe the prepackaged ones don't offer that. Also, it may be convenient to go pick out the single serving hummus and carrots, but it's going to cost you more. So you can actually have larger quantities, enough for the week, or maybe even a week and a half, versus buying the single ones, which you may get less for a higher price. So I suggest cutting up your vegetables such as carrots, peppers, zucchini, and buying a whole serving of hummus versus the individual servings, and just making your own snacks. Also, an extra cost, a lot of people buy cases of water. Just grab you a refillable water bottle. This will help eliminate a small cost. But the cost of water per case will eventually add up. So you can save money and use that for additional food that you might need later in the month. Also, by preparing your own snacks, you're going to want to limit foods that are high in sugar that might help you treat and prevent diabetes. And next, leftovers and creating new meals with the food items you already have. It's time to get creative. Let's just say you're tired from work, the kids had a soccer game, and it's been raining all day, and it really would be convenient to order takeout. But you've prepared a frozen meal, you can pull it out and enjoy without feeling guilty about spending an extra $25 to $30 on takeout that you didn't plan on spending, and maybe that money was actually budgeted for something else. So now you've prepared ahead of time and avoided overspending. Also, another great option for creating a new meal is maybe you made you had baked chicken one night, and you can use the leftover on a salad the next day as a great source of protein. So on this slide, we have an example of a traditional taco recipe that shows how to swap out different ingredients to make your traditional meal healthier without losing the flavors that you love. So, for example, if you still want to use a tortilla, opt for whole wheat, or use a lettuce cup, fill it up with all your ingredients, such as ground turkey and your tomatoes, and you can even squeeze some fresh lime juice on there and enjoy. And you're cutting out some of the extra carbs. Ground turkey is a great option for swapping out with ground beef. Ground turkey has a lower fat content, and ground beef is linked to different chronic diseases such as cardiovascular disease. So you want to eat red meat in limited quantities. Also, if you create your own seasoning versus using a prepackaged one, you can control the sodium intake that you're consuming. If you can't make your own seasoning, then try to opt for a lower sodium one. And small changes can add up and make big differences. Something simple as switching regular cheese for a low-fat option will help you out. Also, we can substitute non-fat Greek yogurt for sour cream, or just leave it off completely, or maybe replace it with avocado and guacamole. But non-fat Greek yogurt is a great option because it helps with your digestive tract with the probiotics that are in Greek yogurt. So, play around with it, make it work for you. If you want to also cut out some of the toppings, that'll help reduce some extra calories as well. Changing your eating habits is a great place to start when trying to prevent or manage diabetes. While eating healthy may seem expensive, eventually the change will add up. For example, you may feel as if you're spending more now on healthy food items. However, creating good dietary habits will assist in fewer medical bills due to health issues caused by poor nutrition, such as diabetes. And while behavior change can be hard, it'll save you money and add years to your future. So, let's talk about getting the entire family involved in building healthier habits. That includes eating better, increasing physical activity, and finding different solutions to barriers that you may face. So, you will have better success if you involve the entire family in eating healthier and working out together. Find new ways to make traditional recipes healthier and cook the meals together. You can even, everybody pick a healthy recipe, write it down, and let's just say Sunday is meal prep day. put the recipes in a hat and pull 2 meals out for the week, go grocery shopping together, and then cook the meals together. Just involve everyone so they can learn to create better habits. Now, creating a healthier lifestyle can help prevent diabetes and other health conditions that are linked to obesity. Also, let's find solutions that work for the entire family and help solve additional problems. For example, eating at home can provide not only a nutritious meal, but it'll help you save money rather than eating out. Now, while eating healthy is important, so is physical activity. It's going to be important to increase your physical activity and learn that exercise does not have to be expensive. There are so many ways to get moving without spending a dime. Some great tips are use water bottles or other items around the house, such as canned food items, that can provide as light weights. You can walk around the house lifting the weights just to get in some extra movement. Grab a friend, go for a walk in the park for a change of scenery, or even if you don't live far from the grocery store or the bank, wherever you're going, leave the car at home, take a walk to wherever you need to go. Turn on some music and have a dance off with your family. The kids will love it. Also, another great option is while you're trying to relax and watch TV, just do a simple workout such as sit-ups, crunch, or planking during the commercials. Now, we will go over 2 different government-assisted programs that will help provide nutrition assistance. The first one we're going to talk about is SNAP. That is the Supplemental Nutrition Assistance Program. Their mission is to increase food security and reduce hunger by providing children and low-income people access to food, a healthful diet, and nutrition education. Some of the foods that can be purchased using SNAP are fruits and vegetables, meat, poultry, and fish, and dairy products. These first 3 bullets are also foods that you will find on the perimeter of the grocery store. In addition to, you can also purchase breads and cereals, other food items that you may find on the center aisles of the store, such as snack foods, and non-alcoholic beverages. This could include soda, even though you want to limit your intake, and juices. You can also purchase seeds and plants that will help you grow your own nutritional food. For example, you can purchase a tomato plant and create your own garden. This may be another activity to do with your family. So if you're interested and see if you're eligible for this program, you can visit this website below to see if you qualify. In addition to SNAP, another government assistance program is WIC, which stands for Women, Infant, and Children. This is a special supplement nutrition program. WIC provides the following: supplemental foods, healthcare referrals, and nutrition education. The participant eligibility for this program includes low-income pregnant breastfeeding women, non-breastfeeding postpartum women, infants and children up to the age of 5 who are found to be at nutritional risk. If you would like to see if you are eligible, we can help you get in contact with your local agency to set an appointment to see if you qualify. And at the end of the seminar, we will be providing assistance to anyone who is looking to sign up for either program. Sign-ups will be in a private room, or you can set up an appointment with a community worker to sign up for a later date. At this time, are there any questions? Thank you for your time, and I hope you enjoyed the presentation.